I'm Dr. Jennifer Avegno, Associate Professor of Emergency Medicine at LSU New Orleans and Director of the New Orleans Health Department. And I want to thank the American College of Emergency Physicians for the tremendous honor of being named the 2025 Public Health Trailblazer. I'm truly humbled, particularly when considering the giants of our field who've received this award in the past few years. To me, emergency medicine and public health are inextricably intertwined, sharing the same mission to care for everyone in our community without barriers, to mitigate suffering, and to valiantly attempt to patch over the gaping holes in the overall healthcare system. As emergency physicians, we are the last resort for the most vulnerable in our system, who are generally repeatedly failed by it on multiple levels, and we've always been attuned to the ways that social determinants profoundly affect our patients. Like public health, emergency medicine is underfunded, overstretched, and expected to solve the world's problems in the face of tremendous barriers and challenges. And now, in the face of a public health crisis, though, there is no one better than an emergency physician to lead, both at the bedside and to the public. We can deeply understand what's happening on the ground in real time to provide critical data for communication and decision-making. We can prioritize the greatest needs first, and we're used to thinking quickly and acting aggressively to stabilize a patient or a community. We can put out multiple fires at once, and perhaps most importantly, we're comfortable delivering bad news or saying "I don't know" with honesty and compassion. We're humble enough to let others take credit for many of our wins, and we're often the only ones standing up to admit failure. As the future of public health in America faces grave uncertainty, emergency medicine must support our public health colleagues through advocacy, experience, and collaboration. We need to keep telling the stories we see in the emergency department as examples of the real-life consequences of society failing to provide basic needs or restricting access to care based on poverty or citizenship, or of the tragic results of harsh restrictions that limit reproductive care. I'm so grateful to stand alongside many colleagues in ACEP who are committed to public health, and I proudly accept this award on their behalf. Thank you.